Welcome to Healthy Living with yours sincerely, Oluije Oikohai, the last edition in the year 2024. And sure, today on Healthy Living, we're looking at chronic kidney disease. And to do that with us is a person of Dr. Aluya Eseosa. She is Senior Registrar of Nephrology Unit, UVTH. Good afternoon, ma'am.
Good afternoon.
I'm glad to have you here with us, being the last edition of the year 2024.
It's good to be here.
Thank you so much.
And compliments of the season.
Same to you. All right, so quickly now, chronic kidney disease. Now, everywhere we go to, we hear people talking about kidney diseases, affecting both the young, the old. Gone are those days we used to know that sickness or illness usually happens to those elderly persons. But now we find out that as little as a 2-year-old child coming down with some ailment, and you're wondering, what has this child done? What sin has this child committed, and all of that. So today we're looking at chronic kidney disease. Now, first off, what is kidney disease? Before we come to the chronic kidney disease.
Okay, thank you for that question. Kidney disease generally are diseases that affect the kidney. Now, it may not just be the kidneys alone, maybe part of the kidneys, like the part that connects the kidneys down to the bladder. So that's the urethra. Then it can affect the kidneys as well. So when we say kidney diseases, we're talking about diseases that affect the kidneys itself, then and other organs that leads into the kidney, like the uretras. There may be a blockage there, progressing ultimately to affect the kidneys itself.
Okay.
So there are various causes of kidney diseases. There are various things that could happen to cause kidney disease. It could be kidney stone. It could be a kidney infection, what we call pyelonephritis. It could be a primary kidney disease, like a chronic kidney disease, or an acute kidney injury. So together they constitute kidney diseases. That's why I said, but if we're talking specifically, we can narrow down to a particular part of the kidney disease, which is chronic kidney disease. So that's basically it.
So how does one have kidney disease and it gravitates into chronic kidney disease?
Okay. Now, when you say somebody has a kidney disease that progressed to chronic kidney disease, it may not just be...
At what stage?
Yes, it may not just be kidney disease itself.
Okay.
There are other conditions, generally, systemic conditions that someone may have, then ultimately progress to chronic kidney disease, not primarily occurring in the kidneys. And that's what we're having of recent. For example, somebody is hypertensive over a long time, uncontrolled. This person is on drugs, is on medication prescribed by a doctor, but is not taking it. It can progress in the long run, say 5, 6, 10 years, ultimately to chronic kidney disease. Diabetes as well. Some people say, oh, I have sugar, that's all I have, I don't have kidney problem. If diabetes is not controlled, ultimately it may progress to chronic kidney disease and any other disease as well. Blindness, it can lead to stroke. Then also, people that have kidney stones that has not been treated, or no intervention has been done significant enough, can cause an obstruction in the tube that links the kidneys to the bladder, which is the ureters, and then that blockage will cause backflow of blood to the kidneys, and the person can come down with kidney disease, chronic kidney disease, as time progresses. So that's why I said the disease may not primarily be in the kidneys. Yes. Now, there may be diseases in the kidney itself that can progress to chronic kidney disease. There's something we call polycystic kidneys. It's just like pockets of fluid in the kidney. Most people are born with it. It can progress to chronic kidney disease in the long run. I don't know if you're with me. Yes. Also, people that have risk factors, they may not be hypertensive, they may not be diabetic, but there's a family history of kidney disease in the family. They can come down with chronic kidney disease. Their chances of having chronic kidney disease in the nearest future is higher than someone who has no background family history. Then of recent, we are seeing that young people are coming down with chronic kidney disease.
As low as you find someone 15 years,
Yes,
14, even sometimes lesser than that
lesser
age.
than that, yes. Chronic kidney disease in younger age group, in children, is not so common. But if it does occur, most of the time can be from hereditary causes. Maybe somebody was born, there's something we call renal agenesis, the kidney did not develop well, or maybe person also has polycystic kidneys. That can, in the long run, cause chronic kidney disease. Then there's also something we call nephrotic syndrome, like there's excessive accumulation of fluid in the body, the person is spilling urine in the blood. It can cause chronic kidney disease in the long run, and that's usually the commonest, a common cause of chronic kidney disease in young children. But coming back to the adult age group, we've seen that even people as young as 40, 45, 30, 25, they are coming down with kidney disease. Besides hypertension, other things that could cause kidney disease in the younger age group are the abuse of NSAIDs. They call it medicine for a body pain, non-steroidal anti-inflammatory drugs. That's what we call NSAIDs, drugs like ibuprofen, cataflan, diclofenac. You see someone with body pain that ordinarily paracetamol would have worked for. This person goes to the pharmacy, says, I have body pain, and then they give a constellation of drugs that may contain variety of NSAIDs, and then this person takes it over time, they come down with kidney disease. Now you also have some people of recent, they use skin lightening creams, bleaching creams. A lot of young women, a lot of young men do that ignorantly, just to make their skin more beautiful. But unknowingly to them that these creams contain mercury, they contain gold. And in the long run, these things are toxic. They are like toxin to the kidneys. And over time, with continuous use, they come down with chronic kidney disease. You do the test, you see that the blood pressure is normal, the sugar is normal, they are not diabetic, there's no family history. But you notice that, oh, there's this skin change, and you ask, they tell you, oh, I've been using this cream for 5 years, 10 years. That could be the cause. Then also in the younger age group, substance abuse, use of psychoactive substance. Some people take a lot of things that you may not even think is available in our community, cocaine and all that. Use of psychoactive substances. In the long run, they can also come down with chronic kidney disease. These are some of the questions we try to ask when we see younger age group presenting with chronic kidney disease. So there are a whole lot of things that can cause it. Alcoholism, smoking. Smoking can be a risk factor on its own to have chronic kidney disease. But if somebody already has chronic kidney disease, smoking will hasten the progression. It will progress faster, such that the patient will deteriorate faster and progress into the end stage, now requiring advanced treatments in the long run. So invariably you are letting us to know that one does not just come up with going to the hospital and the person is being diagnosed with kidney disease if the person is very, very careful with whatever lifestyle the person is living. Yes.
Now, for a young child, the adolescent, if the person is not involved in maybe abuse of drugs, good lifestyle, but you find some persons say, oh, this my pikin, you know they smoke, you know they drink, you know they do this, you know they do that, and the doctor has said the child is down with kidney disease. How as a doctor, how do you explain these things to the person?
Okay. Now, first of all, like I said, there are risk factors for chronic kidney disease. But also, there are some chronic kidney disease that you may not have a cause. Now, also in the younger age group, there's something we call chronic glomerulonephritis. The person may not drink, the person may not smoke, he may not be hypertensive, but is having chronic kidney disease. Now, if the person is young, say within the ages of 20, 30, 35, not hypertensive, not diabetic. You can't really pinpoint a cause, even after doing all your investigations. You can query the cause or say, okay, maybe this patient has chronic glomerulonephritis. Now, this chronic glomerulonephritis is like an inflammation of the kidneys, like it's a cascade of reaction occurring leading to kidney disease. But to make a diagnosis, to not say this is the cause, you have to take a tissue from that kidney, what we call biopsy, and analyze it under a microscope to be certain that this is the cause. Now, that may be a scenario that plays out. The patient is coming, not hypertensive, not diabetic, not on any drug whatsoever, doesn't smoke, doesn't drink, but he's diabetic. Now, we go ahead to explain to them that, yes, it is possible that these things, your child do not do them. But now we're going to investigate what is the cause. If after you still do the biopsy, you cannot pinpoint that this is what's causing it, then you cannot query the cause. It therefore means that in a senile clinic, there are other advanced investigations you need to do to pinpoint what may have caused it. But be it as it may, I want us to know that there may be some persons with chronic kidney disease. You cannot actually pinpoint what is exactly what is causing this. That's a possible scenario that can play out. Then also for younger ladies, there's something we call systemic lupus erythematosus. It's actually an autoimmune disease. It's a disease whereby we say autoimmune because the body tries on its own, just fighting itself, attacking every organ and all that. So when that happens, there are some tests that you can do to see, could this be the cause? This patient may not also be hypertensive, may not also be diabetic, not using lightning cream, no risk factor whatsoever. But when you do this specialized test, we call ANA, you see that it comes out positive. And you cannot see, oh, probably is this autoimmune disease that is causing this kidney problem. So those are scenarios that can actually play out, not necessarily because the person has a background medical condition that is a risk factor for the kidney disease.
Okay. All right. Now, if one is watching us right now and the person in his mind will be like, what are these signs needed for us to know if one has kidney problems? What are these signs? Now, if I find some person saying, drink a lot of water, you want to urinate, make sure you don't hold your urine and all of that. Okay. What are these possible signs? That's one. Then two, you talked about ladies or female gender now. These symptoms, do they vary? The symptoms from the man and the woman, do they vary? So those are two questions. Number one question is the signs. What are the signs we need to look out for? For one to say, okay, this is what is about to happen. I think I can curb it. So let's start with that first. Okay.
The symptoms and signs, the symptoms are what the patient will actually take note of. The signs are what the doctor will see when they come to the hospital. Now, the symptoms can vary. But normally, when people see that they have swollen feet, they can begin to suspect that, oh, I have kidney problems. Some people will tell them it's liver. Some people will tell them it's the heart. So one of the common symptoms that they can have is swelling. They start retaining fluid in their body. It can be on the face. It can be on the feet. And then the swelling progressively worsens. Then some people urinate excessively at night. They urinate frequently. They wake up to urinate frequently at night.
And it's not like they are pregnant?
It's not like they are pregnant. Sometimes it's not even like they are diabetic because one of the symptoms a patient may have when they have diabetes is that they can urinate often, whether morning, afternoon, or night. These people can urinate often, something we call nocturia, wake up excessively. Now, some people in the long run, they notice that their urine is reducing in volume. They don't urinate as often, as much as they used to do. Now, sometimes also a common symptom they have is tiredness. That may just be the only thing that brings them to the hospital. I'm always tired. I can't do my usual activity. I can't do anything. I can't go to work. I can't drive. I can't go to the market. Then that brings them to the hospital. When you check, you do their PCV, which is the blood level, you actually discover that it is reduced. It is significantly reduced, and then you start asking questions. While asking questions, you discover that, oh, this patient has been having off and on leg swelling, for which he goes to a pharmacy, they give drugs, he gets better, and all that. Now, some of them, also in the long run, because of the complications from the kidney disease, they can come in with recurrent vomiting, Yes, recurrent vomiting, they tell you
Okay.
that.
Okay, so if I can get you right now, first off, you have swelling of
This
the parts
symptom-
of the body.
Yes.
That's for the symptoms.
Yes.
Secondly, you said recurring.
They can have nocturia, excessive
That's
urination at night.
urination. Then third, tiredness.
They can have,
Okay,
yes,
now
I'm
first,
tired.
swelling of the body, some parts of the body.
Yes.
Secondly, you're tired, and the mode of urinating,
May
it
increase.
drops.
Yes.
Okay, we'll be right back after the short break. Don't go nowhere. All right, welcome back. If you just joined us, this is Healthy Living, the last edition, the year 2024. Super happy to say that. I can say it over and over again. All right, so today on Healthy Living, we're looking at chronic kidney disease, yes, with Dr. Eseosa, and she is here with us to educate us more about chronic kidney disease. All right, so we're talking about the symptoms.
Yeah.
First of all, you said swelling in some parts of the body. Secondly, tiredness. And the third is a reduction in, the urine output. Okay. Now, what else?
Okay, so like I said, these symptoms may be in no particular order, but we've noticed that the common symptom that they may come with is leg swelling, pedal swelling. Then other things that could occur could be from complications that is already arising or known to the patient. This patient be having leg swelling, not following up, not seeing a nephrologist. Then all of a sudden you say, oh, I'm always vomiting, whatever I eat, I throw up, whatever I eat, I
stomach
throw
pain,
up.
is it
Yes,
included?
abdominal pain is also one of the symptoms. There are some people, they actually come to the hospital, they say, doctors have told me that I have stomach ulcer. That's what brings them. You say, when have you been experiencing this pain? They say for the past 2 weeks. Then you probe further, because patients will always be more concerned about what brought them. You as the doctor, you are the investigator, you need to probe. You now ask, have you been having leg swelling? Have you been urinating frequently? Or they tell you, okay, yes. Have you been feeling more tired? But the symptom that bring them is tummy pain,
Yes.
epigastric pain, and then you do the test and you see that the values are hitting the roof. Now they can have that. Together they can also be vomiting, recurrent vomiting. Sometimes, also as a complication, they can come with irrational talk. That may be the first presentation. Again, you probe. You do your investigations, you do your urine, you're seeing proteins in the urine, you do your blood test, you're seeing that the values are high. They can come with seizures, also as a complication, because the urea level, which is the kidney is supposed to help wash out in the liver stem, is accumulating is irritating the brain. So those are some of the things they can come with. But as the doctor, you are the one that will probe to know, because other things can cause seizure, unknowingly to the patient that it may be from a kidney problem, or from chronic kidney disease. So when you probe, you find out that these patients have actually been having this symptom. Sometimes the patient will also come and complain that, doctor, anytime I urinate, I notice that my urine is always foamy. What we call increased frothiness of urine. My urine is always foamy. Anytime I look at the toilet, the closet, I see that my urine is always foamy. That also can be a symptom noticed by the patient. So by the time you put these symptoms together. You examine, you are noticing that the patient is actually pale, to show that, oh, this patient is short of blood, is anemic. Then you see that there's swelling, you're doing your series of tests, your urine is coming out, there's protein, the blood is low, you do your kidney test, you see that the values are abnormally deranged, then you start suspecting that this person has had this thing for long. Take note, for you to say this patient has kidney disease, must have gone on for at least 3 months. This complaint may have been there for 3 months before you now say, okay, this person most likely have chronic kidney disease. So these are some of the symptoms that the patient may have to say that will help you at least have an high index of suspicion that this may be what's going on. Then you follow up from there.
All right, so the other question I asked, do they vary, the symptoms, from a man and a woman?
Okay, generally they do not. Chronic kidney disease have symptoms that you will see and say, okay, this is most likely chronic kidney disease. It doesn't matter whether the patient is male, whether the patient or female. These symptoms I just mentioned are things that both male and female will have. There's no particular proportion, gender preference. But there are also things that a female will have that will make you have an high index of suspicion what may be causing the chronic kidney disease. Remember I said there's an autoimmune condition. If you have a female coming to you with generalized body rash or rash that's worsened when they enter the sun, or there's something we call malar rash, just rash all around the nose, they are coming recurrent joint pain, weakness and all that, and the patient is between the ages of 15 to 55 or thereabout, you may suspect that this may actually be an autoimmune thing, what we call systemic lupus erythematosus. So the addition of those symptoms may make you have an high index of suspicion. Bearing in mind that it can also occur in males, just that it occurs more commonly in females. So that may also help you to narrow down. But in terms of symptoms generally, they do not differ. Males and females can have same symptoms.
Okay, now someone might be asking, how often should we go to the hospital to go do a general checkup just to be well and to be sure that, okay, we're in the right shape and the body is functioning properly?
Okay. I will not really put a time frame to it, but I feel that people should always go for health checkup, at least go once in 6 months to know exactly how. The thing is, most of us, we don't. Yes, most Nigerians don't until there's a symptom.
Guilty as charged.
Yes, there's a symptom. When there's a symptom, then I remember, oh, I have to see the doctor, oh, this. And Nigerians are also the ones that, when they have symptoms, they rather take advice from the next door neighbor than go to the hospital. But you discover that going to the hospital, at least say once in every 6 months, will help to avert a lot of these things. Yes.
All right, so how do one living with kidney-related disease, the patient, the relative, how do they care for these people?
Okay, that's a very important question. The truth is, it's not easy on both the patient and the relative, especially when the patient is in the end stage. Now, they will try as much as they can, but it gets to that point where people start, it becomes like a burden. There's something we call head giver's burden. So financially, it's not easy on them. Then physically trying to come down, especially in the end stage when they are not dialysis dependent, you come to the hospital and all that. But Nigeria is also one place where community effort, as in like brotherly love, also come into place. They have relatives around that can help, but on them it's not easy. They do what they can, be it as it may. But in terms of coping, one cannot really tell how they cope, because people have their limits to how they can handle stress. But one thing is certain, there's the financial burden on them, then there's also the psychological burden on both the relatives and the patients. Yes.
All right, thank you so much, Dr. Sirsa, for making our time to be with us today on Healthy Living. And I say Happy New Year to you. We're looking forward to, better understanding of our health facilities and taking care of our body and everything that has to do with being good, healthy, and strong. Thank you so much.
Thank you.
And God bless you.
You too.
All right, till we'll be seeing again next week. That will be in the new year. We'll say keep on living healthy. Remember, health is wealth. Till I'll be seeing you again next week. Do have yourself a blessed day and Happy New Year to each and every one of you. Bye for now.